1 minute to read. Okay, so if you've read and understood, considering it critical case scenario, please tell me how would you manage this patient now?
Okay, so I will manage the patient according to the care of surgical ill patient, critical ill patient.
Yes,
So I'll go through ABCD protocol. So
yes,
I will talk to the patient if he able to talk or not. If he able to talk, that means the airway is patent. Then I will check the breathing. So patient might have shortness of breath, difficulty in breathing, then decrease chest expansion. So I will put oxygen either via nasal pond or maybe via face mask, and then I will check the saturation. How is
yes.
he breathing? Then maybe I have to send the patient for a plain X-ray of chest.
All right, to
Then
rule out what?
to rule out is there any fluid overload like pulmonary edema or
Would you be able to find that out on imaging,
yeah,
plain
on
imaging?
chest. Yes, on chest X-ray we can like see maybe some sign we called maybe obliterated costophenic angle or cardiophrenic angle, then
Right.
alveolar dilatation.
Okay, right. Can you comment on the amount of fluid which has been given to the patient post-operatively?
Okay, then I will go for circulation. The patient is seems like already have given excess fluid.
Yes.
So the patient received 7 liter, which is too much.
How would
Uh,
you assess the amount is excessive?
uh, the patient's body weight, so maybe like 30 ml per kg body weight per hour could be, or maybe 20 ml per kg body hour could be normal for the patient. But here, then we have to check blood pressure, we have to check pulse, then we can rule out urine output, and then maybe we can even do central venous pressure line to check the CVP.
Please comment on the factor that patient post-operatively is hypertensive, tachycardic,
Yes, so
saturation
the
is
patient is
compensate, but
hypertensive.
oligouric,
Yes. So
despite the
patient
fact
is
you are giving
hypertensive
furosemide.
and then tachycardic. That means uh, the patient, the heart is already overload. Then
And
it cause heart failure and maybe the pulmonary failure. That's why the patient is desaturated.
no more oligouric while you are giving diuretic furosemide. What might else has happened? And it's
So
supposed
the
to operative case.
patient have like third space loss, and then that's why the patient is oliguric.
Okay, how likely is it that patient can suffer from acute kidney injuries after procedures? When
Uh,
exactly that comes in picture?
I didn't get it, ma'am. Sorry.
Yes, I'm asking you how likely it is, how possibility, what is the possibility that patient post-operatively suffers from acute renal injury?
So if the patient develop like dehydration, for severe dehydration, patient might have acute kidney injury
Yes.
post-op patient.
Do you think this patient is dehydrated? That was my question. Because on
This
one side
person
you're
is
discussing,
having is fluid overload, so
but
could
how?
be
There is oligouric despite
due to
symptomatic.
the third space fluid loss. So the patient is having
What is
having
third
like,
phase fluid loss?
because the fluid, most of the fluid is going into the interstitial space, so they are not
Okay.
in a vascular space. So it went
Okay.
to the extravascular. That's why it didn't go through the kidney and the renal tubule. So the patient might
Yes.
have a
So
renal
what would be
failure and
your
oligouric.
next measure in order to take care of patients'
So I have
hypertension
to,
and oliguria?
yes, so I have to stop the fluid.
Okay, right.
Then,
This is the
uh,
most important thing that you should have told in the beginning, right?
yes,
Then,
ma'am. Then we can check for urea and electrolytes. How
all
is
right,
the
right,
electrolytes, potassium and sodium? Patient might have hyponatremia or hyperkalemia. We
right.
have to correct the electrolyte
Yes,
imbalance.
yes,
And then we can check the patient's mental status, capillary refill, urine output, and if possible, then central venous pressure in high dependency unit. Then I could inform the ITU register
yes,
and my consultant.
yes. Who would, all right, okay. This you've done. What would you consider in order to calculate the blood pressure of the patient?
So for blood pressure calculation, we can use like stroke volume into cardiac output.
All right, okay. How would you, all right, what measures would you take in order to manage the blood pressure of the patient?
So the patient is already hypertensive, so we might add maybe or Lasix is already given. So uh, I don't know, we can give mannitol or what else we can give.
Yes, what else can you give? All right, you said, right. How cardiac output is associated with the blood pressure and total peripheral resistance?
Okay, ma'am. So blood pressure is a product of cardiac output and systemic vascular resistance.
Okay,
And the cardiac output is the heart rate into stroke volume.
right. Please tell me what is the normal water requirement for an adult patient?
So that one we can maybe 10 to 20 ml per kg body weight per hour.
Basic is 30 to 40 milligram per kg per day. All right. Can you please tell me which fluid would you consider giving to the patient, normal saline or Hartmann solution, and why?
Okay, so a patient we have to like decide upon the condition. Is it
This
a bile
patient,
obstruct?
yes, in front of you, this one.
So this patient is already received a lot of fluid, so now we have to stop the fluid. So
Yes,
if we go for maintenance fluid, then maybe we can give Hartmann solution because it's already have taken 4 liter of normal saline.
yes. Why Hartmann solution? That's my
So
next.
here maybe if we give more normal saline, patient might have a hypernatremic, hyperchloremic metabolic acidosis.
Yes,
So to prevent that one, we can give Hartmann because Hartmann having like low sodium, low chloride, and also
yes.
having potassium and bicarbonate and some lactate.
Basically, what is the purpose of giving fluid therapy post-operatively?
So postoperatively to maintain the hypovolemia and maintain the blood pressure
And
and
please tell me
maybe
two more.
sugar.
Yes, okay. To satisfy the part of the entire basal requirement of the patient, like water and electrolyte balance.
Yes, ma'am.
Then to replace fluid and electrolyte loss, right? And to
Yes.
support arterial pressure. What would you think in what kind of shock this patient might be?
So this patient might have cardiogenic shock, or could be even a hypovolemic shock because of a 30 space loss. And what else?
Okay. Right. Thank you. Well, it's gone.